Thank you and good morning. Thank you, Larry, for that kind introduction and certainly for your tremendous leadership. It is such a pleasure to be here with all of you this morning. I have heard such great comments about how insightful, how energetic, how informative this conference has been, and so it's truly a pleasure to participate in your closing day. Like many of you, I come to this conference and to my day-to-day work really with a deeply personal commitment to serving others. My parents came to the United States from Haiti, where they were both educators. My mother was an elementary school teacher and my father was a school principal. And they came to the US because they believed America to be a nation of opportunity unlike any other. And in that belief, they found the courage to start anew, to leave everything that was familiar to them. My mother's first job was as a live-in nanny, and my father painted boats for just $1.75 an hour. But from them, I learned the meaning and the example of hard work, of sacrifice, and perseverance. And like many of you, I gravitated to healthcare as a means to be able to serve those who are most in need. Today, I have truly the honor of serving as the Deputy Assistant Secretary of Minority Health and Director of the Office of Minority Health, where our mission is to improve the lives and the health of minority populations by developing policies and programs that will help to eliminate health disparities. And in that work, frontline healthcare providers like you have an absolutely critical role to play. I'm sure many of you are familiar with the words from Dr. Eugene Stead in an essay that was published over 25 years ago, where it was stated that as time goes on, more and more places are going to seek people with PA backgrounds. The marketplace looks good for physician assistants, a bright future out there. All that remains is for each PA to seize the opportunity. In this time of transformation, these words are as relevant as ever. And at your work certainly is more important now than ever. As you've heard, certainly from our Secretary of Health and Human Services just yesterday and many others throughout this conference, physician assistants are indispensable as a part of our healthcare system. This is especially true when we speak of our most vulnerable and underserved communities, in hospitals and clinics, in community centers all across the country. You're the healthcare professionals that many patients see most often. The care that you provide literally can be the lifeline for patients who may not otherwise have access to care. We need only to look at your awardees for the Humanitarian Award, the Service to the Underserved Award, the Life Changer Award, who certainly exemplify this. And so when it comes to improving the health of minority and underserved communities, your leadership is crucial. As you have no doubt seen for yourselves, the unfortunate reality is that health disparities among racial and ethnic minority populations continue to persist in our country. They're more likely to suffer disproportionately from diseases that are often preventable. They're more likely to suffer from higher rates of illness and death resulting from serious conditions like diabetes, heart disease, and cancer. Less likely to receive the recommended preventive services needed to stay healthy, and when they do get sick, less likely to have access to quality health care. All too often, people of color are struggling to achieve good health because the health care and services that are available to them do not adequately address their needs. These barriers to health, as you well know, go beyond our healthcare system as it has existed. It's also the places where many communities of color, where people live, where they work, where our children play and go to school. Places where the social determinants of health are stacked against them. But these disparities do not only burden communities of color. They truly exact a tremendous cost on our country as a whole. Whether that's measured in economic terms, where we've seen studies that have concluded that the cost of disparities in premature death exceed $1 trillion, or considered in the context of the American promise of equality and opportunity. But I am here today because I truly believe that we have a chance to realize that American promise. 3 years ago, when the President signed the Affordable Care Act into law, it opened up an unprecedented window of opportunity to transform our entire system of care. Now, there's a storied history in the journey that it took for us to get here, from the doubts and the debates about aiming too high and thinking too big, to the naysayers who doubted that it would withstand the challenges that came its way and take hold as it was intended to be. The support of groups such as this Academy has been so vital to our efforts. And now, as we implement the Affordable Care Act, we can step back and recognize all that it represents. In the words of Secretary Sebelius, it's not just another law. It's the culmination of decades of work. It's the kind of historic step forward for equality and opportunity that most of us will only see once or twice in our lifetimes. Today, the Affordable Care Act is transforming healthcare for Americans all across the country by expanding access to coverage, making healthcare more affordable, and improving the quality of care, especially for those in our most vulnerable and underserved communities. Those investments include initiatives such as the education programs to produce more and more physician assistants, because we know that strengthening our nation's health and human services workforce, including through the diversity and cultural competency of that workforce, will help us to improve the care for those who are most in need. That's the idea behind investments like the National Health Service Corps, bringing more PAs into communities that are most underserved. And thanks to the Affordable Care Act and other historic investments, the number of clinicians who are now serving in the Corps has nearly tripled since 2008. And even as we work to strengthen our existing networks and apply proven strategies and levers for improving quality and equity, we recognize that the transformation of healthcare is going to require many partnerships, especially on the front lines. That's why the healthcare law is also calling for new investments in community health teams to manage chronic disease, which we know has a disparate impact on minority communities. These are opportunities such as our department's Healthcare Innovation Challenge, a funding opportunity for care models that will promote better health, deliver better care, and ensure lower costs through improved quality, especially for those with the highest healthcare needs. And we are drawing on new tools and new technologies because in order for us to truly eliminate health disparities, we have to be as innovative as possible. We have to know how to reach those who have often been dismissed as too hard to reach. Just a few weeks ago, the Office of Minority Health announced the winners of the Reducing Cancer Among Women of Color Challenge. This was an app challenge that we put forward to software developers and entrepreneurs to help us create an application for mobile devices, which we know the use of mobile applications, mobile technology is increasing at a rapid rate, in particular among minority populations. To develop an application that can be used to provide health information to women who are at risk or have been diagnosed with breast or gynecologic cancers, which we again know have a disproportionate rate of morbidity and mortality in minority and underserved communities. I know this Academy is understanding the importance of technology, having launched our own apps as well, to be able to access information, provide patients with information, and be able to make linkages between care teams. What each of these initiatives focuses on is a different area for improvement, a different lever for progress. But what they all have in common is the recognition that no single individual, no single organization, and no sector alone can help eliminate disparities. Achieving health equity calls for all of us to be at the table. So from strengthening access to investing in prevention to opening new doors to coverage, the Affordable Care Act is one of the most powerful pieces of legislation in our nation's history that will help us to reduce health disparities. But we recognize that it isn't enough to just initiate a transformation. Too often, sweeping change has a way of missing the communities that often need it the most. And that's why just last month, the Office of Minority Health joined our partners in releasing the enhanced national standards for culturally and linguistically appropriate services in health and health care, also known as the CLAS standards. The Affordable Care Act references at numerous points the importance of culturally and linguistically appropriate services, messages, and knowledge. That is, services that are not only effective, but understandable and respectful to every person at every point of contact. That's exactly what the enhanced CLAS standards are designed to address, to establish a framework for providers and health organizations to deliver culturally and linguistically appropriate care. because the consequences of linguistic barriers and cultural differences in healthcare have been considerable and all too costly for many in our communities. When I participate in the discussions about the challenges that minorities face, not only about accessing and reaching a provider, but finding a provider that they can talk to, that understands them, because of language barriers and/or cultural differences, I think about my own family's experience. When I've been to the hospital so many times to visit loved ones, and all I wanted to do was to pray for them, to wish them well, to be there for them as their granddaughter or their niece, and yet I'm called upon to be the translator at a time that can be so emotionally trying for my own family. You see, in order for us to provide high-quality care and services, we must provide culturally and linguistically appropriate care and services. This is our chance to address the inequities that have persisted for far too long, to improve quality of care, especially for those who are most in need, to turn our growing diversity into a powerful lever for transformation in health and healthcare. When we speak of culturally and linguistically appropriate services, we mean those services that are not only respectful of preferred language or cultural health beliefs, but also health literacy and other communications needs that are exhibited by every person throughout an organization. But the enhanced standards also recognize the breadth of culture, that it is not only race and ethnicity and language, but also other factors such as spirituality, such as disability status, such as sexual orientation and gender identity, such as where one lives, whether one comes from a rural area or an urban area. That all of these factors are important when we think about providing culturally and linguistically appropriate care. And we also recognize with these new standards the importance of governance and leadership at all levels. The importance of that because these standards, all told, empower health and healthcare organizations to serve what will continue to be an increasingly diverse country. And we're encouraging everyone, from individuals to organizations, to take part, promoting, adopting, and implementing these new standards. And I'm making that call to this academy, that as an organization you join us in supporting and implementing the standards and culturally and linguistically appropriate services, and let this academy and all of you as its members be the model of what it means to serve those who are most in need, those who are most vulnerable, and provide them with culturally and linguistically appropriate care. You know, if we step back and look at how each of these pieces fit together, from the Affordable Care Act to the CLAS standards, what they add up to is a remarkable moment of opportunity. And this is just the beginning. Certainly you heard Secretary Sebelius speak about what is ahead for us in October, the opening of the new health insurance marketplace that will introduce a whole new way for Americans to shop for affordable health insurance coverage. Millions of Americans, including many minorities, who will now have a chance to gain coverage, some for the first time ever. But just making coverage available isn't enough. It's one thing to pass a law and ensure that access and coverage are now available. It's another thing entirely to get people enrolled and to get them connected to care. And so as we prepare for October, we are working to make sure that we're getting the word out and reaching those who stand to benefit the most. Because as the implementation of the healthcare law continues, it's our charge to press ahead, to keep the momentum going, to ensure that we make the most of this remarkable moment of opportunity. And whether we rise to meet it, whether we can look back 50 years from now and say that we faced a period in history at a remarkable time of change, it depends on all of us, working together, hand in hand, to ensure that we provide everyone the opportunity to live a healthy life. So as we look to the road ahead, let me simply say, we need your help. In the face of persistent and pervasive inequities in health and healthcare, we need everyone to be a part of the solution. As frontline providers and leaders in your profession, you are the ones we are looking to. We need your expertise. We need your influence in your communities and on the front lines of care. And we need your voices at the table, especially when the voices of those you represent and those whom you serve go unheard. I commend you for your hard work. I thank you for your steadfast commitment and advocacy, which I know is not always easy, but it makes me think of a Haitian proverb that says, "Main en pile, chai palou." Many hands together make the load lighter. And I hope that you believe, as I do, that if each of us steps up, does our part, and works together to ensure that all members of our community have the opportunity to live healthy lives, I truly believe that we can make the most of that opportunity. Thank you.